Hear, hear. Senator Alsobrooks.
Thank you so much, Mr. Chair. I'd like to say I'm just really glad, first of all, that we're actually having this discussion and conversation. This is, I have to note, the very conversation that my colleagues and I were begging to have before open enrollment began, and so I'm really glad that we're having it. And in fact, this is not an abstract policy debate for Marylanders. You should know that my constituents are calling and writing, and so many of them are sharing their stories with me and have done so at events across the state and even at my grocery store about their health care premiums and how they will skyrocket next year. It is an extreme concern, and instead of solving the crisis, it feels like we've taken a time machine to a time before the Affordable Care Act reimagined what health care was supposed to look like when patients with pre-existing or chronic conditions were either denied outright or priced out of coverage. And the Affordable Care Act, we know, is not perfect. And in fact, few laws are, but more needs to be done to increase affordability and access to coverage. And we should work together, I believe, on good faith solutions instead of revisiting what I believe to be old rhetoric about gutting the patient protections at the core of the Affordable Care Act. And put simply, I am not willing to go back to a time when a family member's cancer diagnosis was a sentence for bankruptcy. And so I have just a few questions. I'll start with one for Ms. Strauss and Dr. Fegan. And it's that we know that pregnancy dramatically changes a person's calculus and need for health coverage. And before Thanksgiving, I introduced the Healthy Mom Act, a bill that would create a special enrollment period for women to enroll in coverage after they became pregnant. Ms. Strauss, your testimony recommends codifying short-term limited duration insurance plans. And I want to just be reminded about whether these short-term plans typically cover pregnancy or maternity care.
So they can, if you're on one of those plans prior to being pregnant, then it would have coverage for you. But if you're trying to get it after you're already pregnant, there is underwriting involved in that. I do think, though, that the Affordable Care Act does have a burden on these women who do get pregnant afterwards because of some of the restrictions and restraints around when you can enroll in the coverage. So I do think that is something that needs to be looked at on the Affordable Care Act side of things. So then that way, if there is a pregnancy where maybe they did not have access to health care coverage previously, but I also think there needs to be limits on it to get them to the next open enrollment date. So then that way they have to actually enroll and get signed up like they should have, for that next policy year. So I think there needs to be some parameters around it. But I do think in that situation, we should have some different enrollment opportunities.
And I agree because, to be clear, these short-term plans actually do not cover a pregnancy. 0% of the ones that we looked at so far cover it. And I understand and agree with you that it actually should, because just to be reminded, it costs $30,000 for a cesarean and somewhere close to that for a pregnancy, a regular pregnancy. And so it is so draconian to suggest that pregnant women should have to use half their salary, if they have that much, just to cover the cost of pregnancy. And so that is what we're looking at when we talk about going backwards to a short-term plan.
In Iowa, our insurance division looked at those short-term limited duration plans and put additional parameters around there to protect situations like that. So if you haven't looked at the Iowa short-term limited duration plans, I would encourage you to do that. But again, this is where each state comes in with their population and has an ability to actually do something that is right for them. We had a plan prior to the ACA that covered everyone, regardless if they had a new diagnosis of cancer mid-year with no insurance. They had guaranteed issue. That's the program we should have instituted instead of the Affordable Care Act, to make sure the most vulnerable people in our society had coverage. So we went backwards in Iowa. This really destroyed our health care and the access to health care in the state of Iowa.
The vast majority of the country, I have to point out, this is not the case. And because my time is waning, let me just explain what is now anticipated, is that we would go back to a time where pregnancy would not be covered, where individuals who have these cancer diagnoses and other chronic diagnoses would have either this short-term plan maybe not covered, or there would be some limit on how much you can cover. So if your cancer costs you $150,000 per year, it is the case that we're looking at a situation now where there's a ceiling on how much of your cancer care can be covered or how much your cystic fibrosis care can be covered. We're looking at a time, again, we're totally going backwards. And I wanted to be very clear what we're asking people to do is to, again, face a time where it is more expensive to be a woman and where if you're sick or if you're vulnerable, your health care will not be covered.
Senator, I'd like to add that in the last 20 years, unlike any other industrialized country in the world, the maternal mortality rate in this country has gone up. When I went into practice, 40 years ago, it was less than 10, and it is now over 14 women died for every 100,000 live births in this country.
Thank
We're
you.
unlike any other country in the world.
The wealthiest country in the world. Thank you.